Right. So tell me, and if you could look basically here,
Okay.
tell me how you're using ultrasound in your practice in general.
I use ultrasound both for diagnostic purposes to help get to a precision diagnosis for musculoskeletal problems. That means problems with bones, joints, muscles, tendons, and also to look at nerves. In addition, I use ultrasound to guide procedures, so to guide a needle to a specific spot. The use of ultrasound allows me to tease out between different diagnoses. In a knee, for example, or even just in the side of the knee, there might be 3 or 4 structures in close proximity to one another, and I can assess each of those structures. I can test them using live dynamic ultrasound maneuvers, and I can push on a spot that I think might be symptomatic to get very real-time information about what is causing somebody's symptoms. After I've come to what I believe is a precise diagnosis, I could stick a needle at that precise spot under ultrasound guidance and sometimes do a proof of concept injection where I'm just putting anesthetic, a numbing agent, right at the spot as a test. Ultimately, that's another diagnostic procedure. And then ultimately I can provide a therapeutic intervention to try and stimulate a tissue that's been injured to heal.
Okay, great. So how just kind of circling back, in your practice, how long have you used ultrasound, and how has it evolved over time in terms of day-to-day use?
I started learning how to use ultrasound in about 2007. That was, what is that now, 14 to 15 years after finishing my medical training. So I elected independently to learn how to use ultrasound as a modality because I saw that it was going to enhance my ability to practice sports medicine. And it took me probably 5 to 10 years. It's I guess now more like 12 to 13 years, but it probably took me close to 10 years to get to the point I'd call myself an expert. Although I have to say I thought of myself as an expert way too soon. Probably the year after starting I thought I was proficient, but this is the kind of skill set that takes years to develop. So I think that's interesting, but for anybody who's wanting to learn, you have to give yourself an expectation that there are going to be several hurdles to overcome. But it's incredibly valuable and worth all the time and effort. But in any event, I've been using it regularly in my practice probably since about 2009. And it was at the time I started learning it, I also started to teach it. So, which might sound funny, but in our field of physical medicine and rehabilitation, there were many people at the same time that found that this is an important modality to integrate, so there were new courses being made. So I was lucky enough to teach the use of ultrasound early on, which caused me to spend much more time studying it and build a proficiency faster than I might have otherwise.
So earlier you told me that there were cases where you can arrive at a diagnosis more affirmatively and not have so many potential variables. Could you talk about what that means in terms of, better outcomes, faster healing, and so forth using ultrasound?
Absolutely. So I happen to love the sport of soccer personally, and I love seeing soccer players as my patients. So one common injury in soccer is a hamstring strain. And with a high hamstring strain, people will have pain in the lower buttock and the upper thigh. That's also very common for the distribution of a nerve pinch in the back, or sciatica. So commonly I'll see other middle-aged soccer players come to see me, and they will complain of that pain in the buttock and thigh, and often they've been given a diagnosis of sciatica. With the use of ultrasound, I can immediately look for problems with the hamstring to diagnose a hamstring tendon or muscle tendon tear, which allows me to then either be very precise to the rest of the treatment team about the diagnosis to help with conservative management with like physical therapy and therapeutic exercise, and or sometimes the tear could be bad enough that someone might require an intervention to help stimulate healing. That's one.
And that can help to
So
the throughput and the speed of.
Yeah, so if you could imagine if somebody goes through months and months of treatment where people assume that it's a back problem causing their buttock and thigh pain, then they might make little progress. So that in terms of speed of recovery, precision of diagnosis and accuracy of diagnosis is critical. So I'm absolutely clear that on many sports medicine diagnoses, the fact that we can use ultrasound to get to the diagnosis faster makes a difference in returning an athlete to play faster.
Okay. Are your colleagues around the country, you go to all kinds of meetings, you have all kinds of professional contact, are your colleagues where you guys are now, or is there a learning curve still?
Well, there's clearly a big learning curve with ultrasound, and colleagues around the country are using ultrasound in different ways. I think my partner and I use ultrasound in a somewhat unique fashion. That said, there are many people starting to use it for more and more for diagnostic purposes. The diagnostic part of ultrasound is harder because you have to relearn and hone your anatomy skills. It's kind of like entering a cadaver lab every day when you're applying ultrasound for diagnostic purposes, but you're always learning. So there are definitely a subset of our colleagues who have that passion for anatomy and for learning, and their proficiency in using it as a diagnostic tool is fabulous. And then there are a subset of colleagues who choose to use ultrasound more so for ultrasound guided injections, so to increase the precision of their procedures, and some will use it less for diagnostic purposes. And I think, I mean, I have a bias. I think one should pursue the use of diagnostic ultrasound, and that will even enhance the ability to get more precise in a diagnosis, and then their ultrasound guided injections will ultimately be more effective. But there are people using it in a slightly different way, or sometimes in a largely different way in different parts of the country.
Okay. Could you just kind of list off the use cases for ultrasound in your practice, just kind of like a litany?
Oh my gosh. As a physiatrist or physical medicine and rehabilitation sports medicine specialist, we don't limit ourselves to a certain body part. So we could have people who come in with an injury in the neck shoulder region where we're using ultrasound to tease out a sports medicine diagnosis, again, around the neck shoulder all the way to the foot. So my use of ultrasound is whole body. I use it, just some examples. There people in the shoulder joint is very complicated. There's many of our bones and joints have lots of adjacent structures that are commonly injured crossing by. So I use ultrasound to tease out diagnoses in literally every body part. I mean, we could sing the anatomy song, the hip bone's connected to the thigh bone, and we can sing that, and I could readily tell you about in that body region how and why I use ultrasound, or give you specific examples. But literally from the head to the foot, it's in regular use. That's that was interesting. I don't know that I expected that in the beginning as I started to use ultrasound. What we knew already from the 1990s, I think there were studies, in fact, that were local at the University of Washington Department of Radiology, where they had pioneered some of the use of ultrasound. It might have been in the 80s, but they'd been looking at rotator cuff problems in the shoulder. And there was research demonstrating the value of ultrasound for diagnostic purposes. I knew that I was going to learn how to perform a diagnostic ultrasound of the shoulder in 2007 when I started to apply those skills and to learn the skills. I did not know that I'd be also using ultrasound to diagnose a neuroma in the foot or diagnose the difference between an ankle sprain, which is a ligament injury, and an ankle joint injury, or to look at Achilles tendon problems, or to diagnose a meniscal tear in the knee, or to diagnose a tendon tear about the hip that people would typically think is a bursitis, but is almost never a bursitis, or to look at a nerve that's crossing the elbow that could be injured, or to look at something in the chest wall, or a rib problem. So we use ultrasound now to diagnose complex issues from head to toe.
Okay, great. One thing that you had mentioned earlier too was the idea that if you don't come to a definitive diagnosis quickly, say using ultrasound, and the person goes off and there's time in between where there can be additional damage or irritation or whatever, that's problematic. Can you talk about sort of like the quality? I don't want to say safety. I don't know if there's a safety aspect to this, but sort of the quality and the time to diagnosis using ultrasound.
Yeah, I think the topic here is about the chronicity of injury, so how long an injury is there, and a more chronic injury is harder to heal. It will take more time. There are several reasons for that. One is that you develop compensations and then you end up affecting your body mechanics. And so in sports medicine, we wish to avoid that as much as possible. So if we can come to a precise diagnosis faster, we can avoid chronic pain and chronic maladaptations in biomechanics, and so we can help someone recover faster. And yes, we use ultrasound to come to that precise diagnosis faster.
Great. Do you use Sonosite's learning tools online or go to any of the clinics or?
So to be honest with you, my partner and I have created some of the content that is in Sonosite's learning centers online. I have not gone to the learning centers ourselves. One of the first courses I took in ultrasound was sponsored locally by Sonosite and led by a local rheumatologist. So that I have used Sonosite's learning tools in that way, but I understand there's an online ultrasound university, or I forget the term for it, that has a lot of content. And again, I've been lucky enough to help create some, but I haven't used it myself.
Okay. Great. I think that's great.
Okay.
Really nice job.